Can your brain repair after radiation therapy? Can your brain really repair itself after radiation therapy? This is a question many patients and their families ponder. The answer is yes, the brain has some ability to recover after radiation therapy, but how well and how quickly it heals can depend on several factors. These include the type of radiation used, the dose received, and the individual characteristics of the patient. Radiation therapy is often used to treat brain tumors, but it can lead to side effects. These side effects may include cognitive impairments that affect memory, attention, and learning. Such effects occur because radiation can damage brain cells, blood vessels, and the connections between neurons. However, research indicates that many patients see improvements in cognitive function months after treatment. For instance, studies show that around 73% of patients improved on cognitive tests 6 months after receiving cranial radiation, with some continuing to show progress at 12 months. The biological processes involved in brain repair after radiation are fascinating. One key mechanism is neurogenesis, which is the growth of new neurons. Radiation can harm neural progenitor cells, especially in the hippocampus, a region crucial for memory. Some treatments, like lithium, have been shown in animal studies to encourage the growth of these cells and protect existing neurons from radiation damage, which may help improve cognitive function. Another aspect of recovery involves the immune response in the brain. When radiation is applied, it activates microglia, the brain's immune cells. While these cells typically help in remodeling neural connections, excessive activation can lead to the loss of synaptic connections, which can hinder cognitive abilities. Understanding this process could lead to new therapies aimed at protecting or restoring these connections. Additionally, research has found that bone marrow cells may play a role in brain repair after radiation injury. These cells can migrate to the brain and support recovery processes. A drug called granulocyte colony stimulating factor, which is already approved for other uses, has been shown to enhance this regenerative activity and is currently being studied in clinical trials for brain radiation injury. Radiation can also damage blood vessels in the brain, contributing to cognitive decline. Some experimental approaches aim to promote the formation of new blood vessels, which may help in recovery. For example, inducing controlled hypoxia has shown promise in reversing vascular damage and cognitive impairments in animal studies. Despite these encouraging findings, it is important to note that radiation-induced brain injury can sometimes lead to long-term or even permanent cognitive deficits, particularly with higher doses or traditional whole brain radiation without protective measures. Recovery is often partial and can take months or even years. Ongoing clinical trials are exploring various drugs and interventions to enhance brain repair and minimize side effects. In summary, while the brain can repair some of the damage caused by radiation therapy through mechanisms like neurogenesis, immune modulation, and vascular repair, the extent of recovery varies among individuals. Advances in radiation techniques and supportive treatments are improving outcomes, but personalized medical care is crucial to balance effective tumor control with the preservation of brain health. If you or a loved one is experiencing cognitive side effects after radiation, it is essential to consult healthcare providers for tailored assessment and management.